Hey everybody, this is Kerry Smith, Dentist Secure. Just wanted to say hello and give you an update of what's going on, man. We got a lot of calls recently regarding radiation safety, radiation protocols, training, all kinds of stuff. Looks like the state has gone wild. So we called this presentation here, Radiation Gone Wild, brief conversation about the current happenings with radiation, the Texas Department of State Health Services, and your obligations under the laws here in Texas. Hey, this is me, Kerry Smith, 13 years in risk management and insurance. I'm a certified professional in healthcare risk management through the American Hospital Association. So, a lot of the stuff we do focuses on risk management in a macro level sense. And then, how do we apply that down to the dentistry level there in your office? This is what we do. We train dentists. We have trained over 1,300 dental professionals this year in 2016. Lectured at the TDA, have done a lot of individual presentations in offices. We love training dentists, and we know that a need for good training out there. So this is what we do, and we do this for a lot of dentists. I have over 500 dentists we work with now. Like I said, I'm on the road constantly training dentists and doing a lot of educational programs. One thing that I wanted to point out is that we have two businesses. One is Dentist Secure, which does the insurance aspect of your life in dentistry. So malpractice, disability, health. We do practice insurance. We do everything there. On Dentist Secure Labs, we focus on compliance. So HIPAA, infection control, Texas State Board rules, OSHA, risk management, radiation. The reason why we do compliance training as a risk management technique is we feel like if you're only getting insurance from your insurance provider, then it's just like you as a dentist only providing extraction only dentistry. It is one treatment for risk. We feel like training and education is a better treatment from risk than just buying insurance. So these two go hand in hand. So as a risk manager for dentists, we want to elevate the game for you and help you with your insurance and also help you with compliance programs that manage risk in your practice. So Radiation Gone Wild, a brief conversation about the current happenings with radiation, Texas Department of State Health Services, and your obligations. This morning, I had a conversation with Joanne at the Texas Department of State Health Services, and she said this: there's a return to action. They are now getting more active. So 21,700 letters were sent out to all medical providers and offices that manage radiation, even industrial radiation applications, and said they sent this letter out, and it's basically titled, "What is Needed for an X-ray Inspection?" She also said enforcement actions are coming. So you have received this letter. If you have no awareness of this letter, it's been misplaced. It's in your office somewhere. This letter outlines the overall inspection process and the documentation requirements that you need to have in your practice. If you go through this list, you should have the what is needed when an inspector shows up. The list includes this: your current certification of registration, your equipment performance evaluations, you need your 3 previous years, posted notice to employees, operating and safety procedures. You need a copy of your applicable 25 TAC 289.232. That's the dental specific regulation. And by the way, if you need any of this stuff, I've got it. Just call me. I can Dropbox it over to you. And then you also need your notices of violations. Normally everybody puts this in a binder and keeps it up to date. Also, what you need in your binder is the receipt of purchase, or your FDA 2579. So you're going to get this from your equipment supplier. They should have it on hand. If you don't have a record of it, they'll get it for you. Right now, they're getting them right now. They're very busy getting them, so they know that your request is coming if you haven't already posted. You need your annual inventory of x-ray units, and you need your x-ray image processing records. But your inspections will look like this. The RSO, your radiation safety officer, will be contacted 10 to 20 minutes per machine as far as the inspection goes. Your paperwork review can take up to 60 minutes. They will inspect you at an interval of every 4 years. In the work we do with startup dentists, I've seen that it can take up to 3 years for the first inspection to come around. They don't give you exactly, they give you time to fall into the trap of noncompliance if they wait to 3 years. Upon your inspection, please be polite and recognize the inspector. We have a case right now where the inspector showed up and the staff just didn't pay attention to the inspector, and so the inspector left, and the next letter that was received by the dental practice was a notice of violation and an intent to cite So there was some financial penalties involved. If the staff would have just paid attention to the inspector, given the inspector what they needed, there would have avoided this next step penalty. They have a right to be there, but we'll work around your patient flow, and you must admit the inspector. So the penalties look like this. Most documentation issues can be resolved with minimal penalties. It's really up to the inspector. I've had lunch with several of them. They say that it depends on the types of violations and the overall preparedness of the practice of whether or not they're going to give a fine. If you do have a rules violation, there will be monetary penalty, and the penalties can range anywhere. I've heard $4,000 is a pretty solid number. One of the penalties, by the way, that they will penalize you immediately is if they ask your staff, how are you trained on this x-ray equipment? Did somebody x-ray you, or did you x-ray somebody on staff? And if you say yes to those things, it's pretty much an automatic penalty. You're not to provide radiology services to anyone unless it's directly supervised and required for medical purposes. So what do you need to do now to come into compliance? Well, review your radiation checklist that should have come to you in the mail. If you don't have a copy of it, I've got one for you. And ensure compliance with these rules. Ensure your people are trained on radiation safety in your practice's protocols. There's nothing worse than getting accused by an employee of violating radiation rules. They're very simple. You just have to make sure they're on the table and everybody knows what they are. Make your staff aware of process when an inspection occurs. In other words, make sure your staff knows that when an inspector shows up, we got to admit them, and they have to get access to our documentation in our machines. If you have any questions about the rules and regulations, I'm happy to talk to you about them, but here's some phone numbers you can call. I find that these radiation enforcement folks are really nice people if you're proactively outreaching to them. If they're in your office and you're not working with them, they're not so friendly. So make sure that you have an understanding of the rules and you have an understanding of the enforcement. So what's up next? A refresher on radiation rules for dental practices. I'm going to do a class. It's probably going to take me today to get this thing taken care of and get it published. Also, we've incorporated now radiation into our awesome OSHA and HIPAA training programs. Listen, you may have had OSHA training, but not like how we do it. We want to do this training for you. We're a third the cost of everybody else. We're dental specific. I know we can do a really good job for you. So training's out there for you. If you need help with any kind of compliance training, you can call us at this phone number and at our website, DentistSecureLabs.com, or you can go to Dentist Secure and check us out over there too. That's it. Radiation gone wild. If you have questions, please give us a call. Have a good day.